Last time I told you about a patient who spent years being told nothing was structurally wrong until we found something most imaging never looks for. Today, I want to pick that story back up and show you what actually happens after an injury like that is found, what treatment really looks like, and what a realistic outcome actually is. If you've ever been told you have a genuinely significant spinal injury, your mind probably jumps straight to surgery. And I understand why. It sounds serious because it is serious. But that's usually not what happens next, and I want to walk you through why. In this video, I'm going to show you why conservative care almost always comes first, even for injuries that are genuinely significant enough to technically qualify for surgery. I'll walk you through the actual toolkit we use to manage these injuries conservatively, including why the sequence matters just as much as the tools themselves. I'll show you what a realistic, upfront outcome looks like, because it's rarely a complete fix, but it's usually a real, meaningful improvement. And I'll give you an update on the patient from last video's story, including where her care stands right now. I've been a chiropractor in Denver for over 15 years, and how we manage an injury once we actually find it is just as important as finding it in the first place. Quick recap if you didn't see the last video. This patient had spent years in the system: physical therapy, chiropractic care, pain management, multiple imaging studies, and kept being told there wasn't a clear structural reason for what she was feeling. We got updated imaging done, ran a specialized analysis most offices don't have access to, and we found something significant: instability at 2 specific levels in her spine. Here's where things actually stand now. We referred her back to her care team with that new data in hand, and it made a real difference. A request for an updated MRI imaging that had been delayed for several months suddenly got expedited, and we were able to point specifically to where her pain was likely coming from, finding suggestive of what's called facet-mediated pain, meaning the small joints in her spine, not just the disc, are likely a major piece of this. Now, she's still in the process of figuring out her next steps, possibly regenerative treatments, targeting those joints specifically. I don't have a neat, wrapped up ending for you today, but I want to be upfront about that because that's actually how this usually goes. Real progress, real answers, but not always an overnight fix. So what does living with this kind of injury actually feel like day to day? I like to describe it using an analogy that usually gets a laugh, but it's genuinely accurate. Think about a family member, we'll call him Uncle Bob, who shows up to every family reunion completely unpredictable. Some years he's the nicest guy in the room, telling great stories, everyone's happy to see him. Other years, you're hiding the kids and small animals the moment he walks in. That's what an unstable spinal injury behaves like. You can have a long stretch of genuinely good days, weeks, sometimes longer, where things feel almost normal. And then, seemingly out of nowhere, you get hit with a flare that feels like you got run over by a truck. Now, that unpredictability isn't in your head, and it's not something you did wrong. It's actually consistent with how this specific type of injury behaves, which is exactly why once we understand that's what we're dealing with, the goal of treatment shifts a little from eliminate this completely toward get you more good days and fast recovery from bad days. Now, here's where a lot of patients get scared unnecessarily. I used to tell people that an injury this significant technically qualifies for surgery. And while that's true, I've learned that saying it that way sends people into a spiral, imagining an operating room in their very near future. That's usually not what happens next, and I want to explain why. Medicine generally operates on a do no harm principle. Start with the most conservative option that has a real chance of working and escalate only if it doesn't. Even surgeons themselves are typically not eager to jump straight into an operation before conservative measures have been genuinely exhausted. Every medical procedure carries risk, surgery included, and that risk has to be weighed against the potential benefit. And here's something people don't always realize. Even if you do eventually need something more advanced, whether it's regenerative treatment or in rare cases surgery, you're still doing months of the same conservative style rehabilitative work alongside it. Conservative care isn't a box that you check and move past. It's the foundation everything else builds on, regardless of what path you end up on. And here's something worth knowing. Chronic pain patients often see multiple providers, sometimes over several years, before getting a clear, specific explanation of what's actually going on. Every one of those visits costs time and it costs money. And chronic pain itself is expensive to manage long term, regardless of how many providers get involved along the way. Getting to a specific, accurate answer sooner isn't just about feeling better faster, it's often the most cost-effective path too, even though it might not look that way at first. So what does conservative management for an injury like this actually look like in practice? Especially when the injury itself involves the very structures, the ligaments, that some tools rely on to work. The primary tool, and where this almost always starts, is the adjustment. Now this might sound counterintuitive. If a joint is unstable, why manipulate it? But the adjustment doesn't apply the kind of sustained mechanical load that an unstable ligament isn't ready for. Instead, it works through your neuromuscular system, helping restore the communication between the injured area and the muscles responsible for stabilizing it, while also reducing inflammation. Laser phototherapy and dry needling support this same process, addressing muscle tension and inflammation without loading the injured structure directly. Now, tools like a Denny roll, a prolordosis exerciser, or a posture halo, the postural correction devices aimed at restoring your spine's natural curve, genuinely have their place. But they typically come later, once the initial instability has responded to adjustment-based care. Introduced too early, before there's been a chance to restore some stability, now these same tools can actually aggravate things rather than help, which is exactly why they shouldn't be self-directed or started without professional guidance. We also look outside the spine itself early on. Foot orthotics, sometimes a small shoe lift if there's a leg length difference, help balance how force travels up through your body without directly loading the unstable segment. And something like an Invertrack introduced at the appropriate stage can help strengthen the postural muscles that support long-term stability. This is a layered, sequenced approach that I've built and refined over 15 years of actually treating these injuries, starting with what the injury can tolerate and building from there. So let's be upfront about what success actually looks like with this kind of injury, because I don't want to oversell this. Success looks different for every patient, but the core goals are the same: less pain, better function. For some people, that means getting back to mild, manageable discomfort and most of their daily activities. For others, it's a more complete resolution. Everyone's starting point is different, and so is everyone's destination. What I can tell you is what progress usually looks like along the way: longer streaks of good days. And when a flare-up does happen, because with this type of injury, they usually still happen from time to time, a faster, easier recovery than before. That's not a dramatic before and after. It's not a single moment where everything changes. But over months, that steady shift in your baseline is real and it's meaningful. It's the difference between a life organized around managing pain and a life where pain shows up occasionally instead of constantly. So here's what I want you to take away from this video. If an injury like this is found, surgery usually isn't the next step. Conservative care is. And it's a real, sequenced approach, not just crossing your fingers and hoping. And success doesn't have to mean a complete fix to be meaningful. More good days, fast recovery from bad ones, that's genuine progress, even without a perfect ending. If you've been dealing with pain that's never gotten a clear explanation, or if something in this video or the last one sounds familiar, text the word NECKANSWERS to 720-782-0429. Tell me a bit about your situation, and I'll personally get back to you. If this helped you make sense of something you've been dealing with, I think you'll get a lot out of this next video too. It's right here. Be sure to like, share, comment, and subscribe for more helpful content just like this one. I'll see you in the next one.